So good afternoon, everybody. Welcome. This is the Patient Advocacy Training Roundtable. So the purpose of this conversation today is to, number one, talk about advocacy, but also talk about the legislative side of it and how it makes a difference in laws and bills that are passed. We have a panel of wonderful lung cancer survivors and also one legislative representative who's going to join us in a second. We have like 6 or 7 of us on this panel. We could stand here and all share our stories, but that would take up far too much of the time. We want to get right into the conversation. So what's going to happen is all of the survivor stories and everybody's bio is going to scroll on the screen throughout the entire conversation. So you can read those as we go through, but we're going to pretty much jump right into the discussion so that we don't miss any opportunity to just discuss what we have going on. So I'm going to hit play here. So you'll start seeing the bios run through, and we will jump into the first question. First and foremost, we wanted this to be more of a casual conversation. People seem to think advocacy is this cookie cutter, huge event type, situation. We wanted to dispel that myth, but also dispel the idea that this needs to be like this really stiff conversation. We want it to be casual because that's how we feel advocacy should be looked. We should also be just having conversations with people because sometimes that's your most impactful way to advocate. So that being said, our first question for the day is essentially, without sharing your story, can each of us kind of talk about how our personal journeys have influenced the way that we advocate? And when I start the conversations with folks, I usually start by talking about biomarker testing because for me, and as a lung cancer survivor, we get pulled in 1,000 different directions with organizations and people that want to do articles with us, interview us. They want us to come to their events and speak. And you will get pulled in all kinds of different directions by all kinds of different organizations if you don't align with what works best for you. So I started to really align myself with organizations that focus on screening criteria and biomarker testing because those are 2 areas of my journey that I feel like were the most impactful and the most such a catalyst for where I am today. Without biomarker testing, I most likely would be dead because if they tried to do chemo or radiation on me, it wasn't going to work. So I was fortunate enough to have a care team that just did biomarker testing and ran with it. And I came up with the ALK positive mutation, and that's how I am here today. I shared today earlier on social media my side-by-side CT scans of when I was first diagnosed versus January, which was my last CT, and it's night and day. If I had really gone with chemo and radiation at that first initial x-ray, I wouldn't be here today to be talking to you guys. And so I find that to be one of the most life-changing points of my story is that one small decision by my care team to not do biomarker testing could have been the difference between life and death for me. And so I align myself with organizations and, groups and people who are more leaning towards science and research in biomarkers and, talking also about screening criteria. As I mentioned earlier, the previous session was full of lung cancer patients. All of our girls were in there. It was great. And I sat there and made the note that all of us in here are sitting here with several stages of lung cancer, and none of us are candidates for lung cancer screening. So obviously something is missing. There's extreme gaps in the screening criteria where we're missing entire subsets of the population. So that would be how my personal journey has affected the way I advocate. I'm going to turn it over to, and if you want to, I'll start with you, Sydney, since you got it in your hand. We'll start with Sydney so she can talk about hers.
Hi, everyone. So my name is Sydney. I am a physician. I'm an internal medicine hospitalist. I'm also a patient. I was diagnosed in my beginning point of residency. And I think that being diagnosed while going through my residency meant that I was learning how to be a patient and a physician at the same time. So I find that on both sides, there's a lot of miscommunication, misunderstanding. And that's one of the ways that I do my advocacy now, being on both sides of the stethoscope to try to make sure that the patients are informed, to ask important questions, and also to recognize that physicians don't know everything. So sometimes you will be your best physician. If you know about biomarkers and your doctor is not mentioning it, then you can say to them, what about biomarker testing? Can I get a biomarker test to make sure that I'm not going down the wrong path? So I think that is how my diagnosis has affected me. During the pandemic, I was on the oncology floor. So I diagnosed patients. I went through the whole spectrum, dealt with treatment side effects, dealt with when we had to transition from treatment to comfort care measures. I even pronounced death. For me, living with lung cancer, I still have side effects, and that's one of the other aspects of my advocacy now is survivorship care, because a lot of the times survivors feel forgotten when we're dealing with debilitating side effects that, oh, we should be grateful to just be alive. So that's another aspect of my advocacy that I like to talk about.
Yeah. Oh, hi everyone. Colette here. My advocacy work began 3 years before I was diagnosed. My husband was diagnosed with prostate cancer. However, his PSA scores were buried in a physician's file for 3 years. And that's when I started advocating. 3 years after that, I got diagnosed. And I believe there's a pattern here in our under-resourced communities like the Bronx, where we don't get the care that we deserve. I consider myself a leader in my community through grassroots efforts, and that's where I focus my advocacy on awareness and empowerment and screening. Our community, it's not enough to be aware, we must take action. And action towards early screening and possibly curative measures is definitely the position from where I come from.
Hi, guys. I'm Marika. I was diagnosed 2 years ago. All of this is new to me, so I haven't really gotten involved in advocacy, but it is a plan. The funny thing is, almost like a month ago, I went to the emergency room for something unrelated to lung cancer, but a CT scan had to be. I had to get a CT scan because whatever, I had a fever and everything, and the nurse asked me, "Did you ever smoke?" And for me, it was like, as I answered, I told her I've never smoked, but for me, it kind of took me back because I read a lot on lung cancer, and I'm in the groups and everything, and it's like that's a question that a lot of people get asked, which is not necessarily related to, which in some cases it is, but I feel like it shouldn't be the first question that is asked. So I think that's one of the angles I would like to get into, that not everybody who's like, as long as you have lungs, you could get lung cancer. It's not necessarily a smoker's disease anymore, and that sort of thing.
Go ahead, Monique. Well, my journey started 10 months ago. And I was an advocate for sex education. And then I had switched over. Well, I do both now. And I switched over when I found out I had lung cancer. And yeah, navigating now. It gets overwhelming sometimes, because it's just me and my grandmother here. So I have my friends, my outside friends, and my mom lives in Houston. So I'm here I'm here by myself, advocating, and yeah.
Okay. Well, and for starters, the fact that you're only 10 months into your journey and you're advocating is a big thing. I think we all should just take a second to acknowledge, because most of us in the room at 10 months in, I can tell you I was not ready to be advocating. I was not sitting in front of people to tell my story. I'm still grieving and trying to figure out what's going on with myself. So I know for me, I'm looking at you like, wow, like I'm just impressed that you even have the energy to be here for that. But Lakimba, from a legislative standpoint, I want to talk to you, or have you kind of talk to the room about, how our stories can influence policy and how you've seen it happen, while you're on the floor too.
So my name is Lakimba Desideer. I am the CEO of the National Black Caucus of State Legislators that represents over 700 Black state legislators in the country. My job is to educate state legislators, not to tell them what to do, some of them might say I tell them what to do, but it's really to educate them in a direction for them to make powerful decisions that's going to impact communities. I will tell you, through the journey of education, one of the best ways we've been able to do that is personal stories. Putting folks in front of our members that have stories that can either resonate with themselves, with their family members, or that resonates in their community. That is like the biggest deal. The personal story. We always want to educate. We always want to talk about what are the new treatment, innovative ways. But we also want to put a face to that work, particularly whatever's happening in that state.
Thank you. So one of the main things that we deal with as survivors, and there's other survivors in the room as well, but we constantly, we put out things in the world. We're either doing posts, we're doing social media, we're doing these, interviews, we're calling in, like we're constantly having these appearances, and we don't always see that return on our investment. We're wondering, like, is anybody actually seeing this article? Is anybody actually reading this? Are people actually watching my video? And you see the views or you see the likes, and it can be very discouraging, and it can make you not want to do it because you're thinking nobody's listening, nobody's watching, nobody cares. So I want us as survivors to talk a little bit about, what has been the most rewarding part of advocacy for you? And then also let's talk a little bit about discouragement and how you bounce back from that and what that looks like in its various forms. I know for me personally, in the last 24 hours, I've had rewarding experiences with advocacy. I've had people come run up to me at this event that are just excited to meet me in person, which still blows my mind because I'm just, a regular person, like just living and trying to share my story wherever I can. But the fact of the matter is, when we first get our diagnosis, we look to those figureheads. We look to those people that are in the community. We look to those people who have been living with it and working with it. And I was looking up to like the Jill Feldmans and, all the other folks, Heidi and everybody in the community, because that's all we had at the time. And now that lung cancer patients are living longer lives, we're becoming the figureheads in the Black community. And so folks see us thriving, see us living, see us doing our thing, and they're excited to meet us. And we're just like, oh, it's such a change of story and pace for us that it's rewarding. And that for me is exciting because it lets me know I may not see it, I may not hear it, but somebody's watching, somebody's paying attention, somebody is being impacted. And it makes you feel like it just puts a little more pep in your step, knowing that, hey, you're not just, it's not falling on deaf ears. But yeah, it can be discouraging, and people know I have a very big sneaker collection, and I post a lot of sneaker content. It's like my other thing that I do. And I'll post a sneaker video and get tons of views on it. And then I'll go ahead and do an advocacy video or a lung cancer promo and get 23 views. And I'm like, whew, okay. It's very disheartening because it's like I'm posting real content from my heart about what's going on with me, and I'm getting 23 people looking at it when I have 17,000 followers on a platform. And then I post something about a sneaker and I get like 4,000 views. And it's like, okay. So that's the kind of discouragement we deal with, where it makes you feel like you don't want to continue doing it. But, I guess, Sydney, if you want to start, why don't you talk a little bit about, what you've dealt with in terms of, number one, what's been the most rewarding, but also how you deal with discouragement.
I think, as you said, what has been the most rewarding is having someone who said, oh, I saw you, or, I heard you speak somewhere, or, oh my gosh, someone told me about one of the things that you said, and I went and asked my doctor, and that changed their outcome. When I hear someone who comes to me and tells me that, it's like, oh, okay, all right, I'm actually making a difference. But sometimes, I do different types of advocacy. So I will go to Capitol Hill with a different organization, and we'll be asking for $60 million every year for research. And then we get incremental, or last year they wiped us out completely. And you're thinking, I've been to Capitol Hill every single year, and we've been asking for more money, and you took money away from us. And stuff like that can really discourage you. And you can say, well, what's the point? But if you don't get up and say, I need to continue doing this because people still need to hear our voices, then we wouldn't go back to Capitol Hill to ask for more money and get back where we were before, right? So I think that a lot of the times, as Lakimba said, it's about telling your story and personalizing it. Physicians have to, for self-protection, a lot of the times, try to remove a little bit, put up a little wall, because if you have, it takes a lot of energy to have empathy, feeling like that person in that bed for every patient that you're taking care of. Some physicians do it too well, where they've detached themselves completely. And telling the story and kind of breaking down that wall will humanize it. And I think that all of us can do that in various different ways. I feel that a lot of the times we don't know our impact, but it's like a ripple effect. You know, you drop one pebble in and it ripples and it can make a huge wave. I think that a lot of us continuing to throw little pebbles into that river will eventually give that wave that we need to make a change in lung cancer.
I like that. Colette?
Yeah. I advocate in 5 different cancer spaces because these are the 5 cancers that disproportionately impact my under-resourced Bronx community. And one of the most rewarding things is seeing Black men, young Black men in my community, standing up after an event and talking about their prostates. That's been rewarding. And at the same time, when I had one of these events in the community, the turnout wasn't what I expected. However, I had a Black man who was a leader in the community personally call me up and say, not only was he not going to be at the event, but he gave me really sage advice. Don't focus on who did not come. Just focus on the folks that you have there. So that's how I managed the disappointment.
All right, Lakimba, if you can you speak a little bit from a legislative standpoint, what it looks like, when there's disappointment in bills getting passed and hard work that you're putting in to try to move the needle forward?
So 2 things. I would counter what you said about going to Capitol Hill. There's federal funding and there's state funding. Figure out which funding, or if it doesn't happen in the federal, because a lot of time, particularly where we are right now, that federal funding is now gone down to the state. The states are usually the ones that are going to be funneling that money. So understanding what's in the budget, and understanding what is already in law right now, how it could impact. I will say, I gave the example of running a marathon. Just like a marathon, you have to train. To be an advocate, you're going to have to train. And train means acknowledging, if you're that patient, acknowledging where you are, understanding what your space is. Everybody can't be a Jamie on the forefront. Everybody's journey is not Jamie's journey, right? Your journey might be the person that's making the phone calls every day. Your journey might be the one that's contacting all of the pastors in your district. And then understanding, even as this bill is being heard, and first it has to be heard in the committee. Wow, that's encouraging. That bill came out of committee, is now in the House floor. There might be an amendment to it. That might be discouraging, because I don't know if this amendment, because this bill might state lung cancer screening for Black folks. Gonna have to take that Black out. Don't get discouraged from taking that Black out, because the environment that we're in is not going to move with that language in it. But being smart, paying attention to what that amendment is. Moving to the Senate. We're not only going to just take that out, we're going to put another amendment that says you have to be a certain age. Now they're fighting about it. That's a discouragement, and now the bill gets killed. That just means, what do we do from that day to prepare to have this back in session again next year? And even if the bill does pass, it passes this House and Senate, and it goes to the governor and gets signed, that's an actionable success, but the next step is the funding, holding the next group accountable for that funding. So it is a marathon. It's some headaches, you get a Charlie horse, cramp in your back. All of these things come in play in order for the gold medal, which is to be able to provide health to the community. So.
I don't think a lot of us understand that legislative process, so thank you for explaining that.
Go on our floor next time.
Yeah. we got to give you your whole room to talk about the legislative process. So I want to go for a couple of us survivors here. I want to talk a little bit about how advocacy can better reach communities of color. So that's one of the issues that we run into a lot is the communities that truly need, these services, these resources, these conversations don't always get them. So what can we do as advocates? What can we do as, even people just in the room right now? What can we do to reach those communities where they are? I believe, Colette, you were going to speak on that if you can.
Okay. One way that I've taken like a real life situation and applied it to my community, I started this grassroots organization called Healing the Bronx. I started taking care of tree beds. And then that turned into QR codes under those tree beds with lung cancer information. Then I had folks advocating and talking on their own. So in essence, meet communities where they are. I don't expect my Bronx community to travel to Manhattan to get this information. Instead, I bring it to my nicer communities and I share and I try to find what are some of those barriers that prevent them from coming to these events, from screening. Maybe they don't have PCPs. And I try to work with the hospitals in the area to address those barriers.
Yeah. Sydney?
So Brandy and I are actually a part of another organization, and one of the things that they're doing is they're actually bringing this information to Black barbershops and hair salons to basically train the stylists about lung cancer screening, just to talk to their clients while they're in the chair about, hey, I heard about lung cancer screening and X, Y, and Z, and, this is where you can go. You can go to this website if you want some more information, and then they would take it from there. But they trained hairstylists to do that in a setting where you're comfortable. I mean, I chit chat with my girl all the time. She tells me what's going on in her life. I tell her what's going on in mine. And hearing someone who you have that relationship with telling you this information, you are more than likely going to take that information a little bit better than a sterile environment. And I think that is what we're starting to do a lot now with the Black community, especially given the fact that there's genuine mistrust of the medical community. So I think a lot of organizations are starting to realize that they have to go out into the community, with people who look like us to get the information. And that's one of the things that I love about Heal Collaborative, because this is what we're doing here. So I think that these things are starting to happen a lot more now.
Monet, did you want to say a few words on this? No? Okay. So yeah, and Sydney, I'll mirror exactly what you just said. And I was going to say that same thing is like, there's a very strategic reason why HEAL has these summits in the communities that we have them in. Like, we heard about Cancer Alley. We know about all the different things that are going on in Louisiana and the need in this community for this information. So this is how we reach these communities. We start bringing these events to the areas. And then we start, like you said earlier, removing the barriers that keep people from coming, whether it's transportation, whether it's, food insecurity, whether it's housing insecurity. Getting rid of all of the obstacles that keep people from attending things is one of the ways that you reach communities where they are. Because most of the time, if folks got to take off work and pay to travel there and pay to eat and pay to stay, they're not going to go. They're not going to go. And now we're talking to people who, not that they don't need the information, but the folks that truly need the information couldn't afford to get here and get it, and that's how we continue to create these disparities. So I do want to ask for, some of Monet, you're brand new, so I'm going to let you ask this question to some of us OGs in the room here.
Okay.
So for, I'm just going to say how it is. Like, we all have to advocate. Like, we can't be quiet about it. Nothing happens, nothing moves forward with us being quiet.
Okay.
So
I had to get all my thoughts together because, sorry, y'all. It's like,
they need the microphone.
yeah. Oh, it's like I had to get all my thoughts. I was like, wait, what I'm gonna say? I was like, I just forgot what I was gonna say. That's why I'm just being myself. I was like, God, I forgot what I was gonna say. But advocating is very, very, very important. I pushed for 2 years to get a CT scan. They didn't diagnose me until last year. So advocacy to me is everything. Everything. I tell everybody, I don't care, I tell everybody.
Yeah.
Everybody. And when I first was diagnosed, you know, like they say, like you process yourself, I woke up to people, hey, I got lung cancer. Because in my mind, I couldn't believe, I was like, man, what? I was like, God, what did you do with me? Like, why is this happening to me? I was like, I already been through. I had to help my mom raise her kids. Me and my siblings are real close. We went through hell. And now this, I was like, oh my God, what am I do? But advocacy to me is everything, and like research, finding the people, I wouldn't have never thought I would have seen her in person. The first person I go on YouTube and I see her posting her, like, then somebody referred me to her. I can't think of the lady's name. She's an Asian girl.
Aurora.
Yeah, I think it's her. She's so sweet. That's how I found out about Celine.
Yeah.
And I was like, oh, she a doctor. Cool. So what I do is, after all my scans, I send them to I was like, hey, Celine, can you look over this? She got all my scans. Trust me, she know every last one of them. So advocacy to me, you don't keep stuff quiet. I don't believe in gatekeeping.
Right.
So
I don't believe in gatekeeping.
as a new patient, you know, in this community and as a new survivor navigating all this that you have going on, what is something I guess that you would like to see from us who have been in the community for, it's crazy, I call myself, we're OGs now, like me and Sydney and everybody, we're all surviving for years. We're OGs. Yeah.
What I do on this is, well, to be honest. Oh, you already know what I'm about to say. Yeah, to be honest. So like looking into both sides, like the herbal side. Just the herbal side, like the natural side and this side. And repurpose. Repurpose non-labeled drugs that may help. Just saying.
I mean, that's
Repurpose that may help. That may help. That's how we have to put it. That may help. That's how I was taught.
Yeah.
Mm-hmm.
And so we also, in the last session, we talked a bit about like other ways that advocates, what as advocates would you like to see from us? So like, you know, you said messaging us about skits or something like that.
Yeah.
So can you talk a little bit about like, as a new survivor, what would be helpful?
I feel like we come together as doing skits because that's what it is, man. Everybody want to be social media and all this other stuff. And I was like, okay, if we do skits and try to get everybody together about about the lungs and stuff like that, or put on a gas mask and so that, hey, this is good for you, this is not, not just that in general, but make it fun, make it funny or whatever. Yeah. Mm-hmm.
So we only have a little bit more time left. I do want to make sure I give us an opportunity to go around and talk about what the action item is and the call to action for the run. But Lakimba, a little bit earlier you mentioned this and you talked about it, but I want to give you an opportunity to really talk about how our voices as patients can influence the bills and the policies that get passed. So if you could break that down for us.
You're ready to walk through the process? That's your way of saying walk through the process? Okay. So your voice, your concern, whatever that issue is. Can I add this into my takeaways too? Yeah. Okay. No, find out who your state House representative or your Senate is. Who's representing you in your district? Not only find out who they are, find out how they have voted in the last 5 years. I'm not going to say 10, I'll say 5. 2, if they're new, see what they did last year. Because that's going to let you know how they're going to project themselves further on. When that issue comes, when you're sitting down with your state legislator or your group, or you all are sitting down, in certain states, legislators are only allowed to submit a certain amount of legislation. They cannot send 30 in or 20. Certain states, they might cap it to, the House might only have a certain amount, or the Senate. Or your representative might have a certain passion or desire that might not impact the community the way it should. All that being said, staying on top of that individual, knowing that there's going to be a journey, if that piece of legislation makes it to a committee, being prepared to testify, being prepared to find somebody else to testify, being prepared to pack out that committee session. It is not easy. Everybody is trying to survive. And so that might compete against your job. Like, these are the journeys of a bill being heard in the State House. Committee, great. Out of committee, still the work still needs to be done. I talked about amendments. Amendments can tear open a bill very easily. It might not be the direction you want. Find some goal or something that is going to be achievable out of that bill as it moves. If it gets to the Senate, which you hope, understand that you're not going to change everybody's mind. It is okay. You're going to have some advocates, and you're going to have some folks who don't see it as something that's going to be positive because it doesn't impact their community, or they don't want to positively impact our community. Understand that there's going to always be both sides of it, and be clear about it. And stay on top of your member. During session, after session, bill signed by the governor. Which agency is this money coming out of? Is your legislator following up on how this bill is getting delivered? Like, that is a part of the advocacy work that you guys, the journey of advocacy and the policy. What I stated before, policy impacts everything that you do. Everything that you do, there is some and if there's no legislation that is your voice, then be clear there is some legislation that is going against your voice. So if you're not the one advocating for your voice, I can guarantee you, when I'm looking at bills and over the 48 states that we're in, some of the legislation that I'm seeing right now terrifies me. So just be aware is the key piece with advocacy as well.
All right, so we have, what do we have? About 10 minutes left. I want to give everybody on the panel an opportunity to put a call to action out to the audience. What is one thing that everybody in this room can do in the next 30 days to move the needle forward for lung cancer awareness? I'll start since I got the microphone. I got to pass it anyway. I say on my end, and the reason for this panel is to understand that there is no cookie cutter definition of advocacy. You don't have to throw some major grand event with, raise thousands of dollars and have hundreds of attendees at this advocacy event that you're doing. Advocacy can be as simple as existing with this disease and living. That is advocacy enough, and you don't need to justify that to anybody that has a question about it. They're not walking in your shoes, and they don't live your life. So understanding that advocacy can be big, it can be small, and it can be everything in between, but just understand that whatever you can do is what you can do, and you don't owe anybody an explanation to that. We as advocates in the community appreciate any bit of advocacy we get out of folks, where we don't have expectations that people are going to throw massive galas and raise millions of dollars. We just want people to talk about it. We just want people to share. If it could be as simple as somebody who's misinformed, re-educating them gently and letting them know that's not correct. Most of the time, and half of us do it on a daily basis, when we tell someone we have lung cancer and they say, "Did you smoke?" We say, "That's a misconception. I'm going to educate you right now on why that's wrong." That's advocacy right there, letting them know all you need is lungs to get lung cancer. Smoking is just a risk factor. That's it. That's advocacy, and it's as simple as that. So understanding that advocacy can come in all shapes and sizes takes a lot of the burden out of you and feeling like, oh my gosh, I'm not going to do good enough or people are going to judge me. So that's what I would say. Just figure out what it is that you want to do in the advocacy world and just do it. And don't worry about anybody else's expectations.
I would say do your research. And not too much. Research is very much so important. And I wanted to elaborate what you were saying about bringing it to the community. Yeah, very important. Instead of us going out bringing it to the community, I was thinking about that with my cousins and stuff like that, like having certain things. Mm-hmm.
I'm going to piggyback on what you're saying, research. I'll say research what laws and legislation is already happening when it comes to lung cancer. Look for keywords, lung cancer, biomarker testing. Find out what's being disbanded as well. That would be the key piece, I would say. Find out what policy is impacting your states right now. All politics are local. Oh, about them.
I would say I like the research laws because I've never really looked into that. Like, I read a lot on lung cancer, but I've never really looked into like the laws and stuff like that. So I think that's pretty interesting, and I will do that for sure.
And I said, try to tell somebody new your story. I I have like an airplane pitch, right? Like people are usually kind of nosy. I don't say anything about it most of the time, but if they're asking about what are you doing, most of the time I'm traveling to some kind of lung cancer event. And so like, yeah, I'm going to a lung cancer conference. And I've had to work on how I speak about it, because the fact is, you know, we talked last time, I mean, not everyone was in here, but about the importance of what your advocacy goal or what you're wanting to increase. And biomarker testing is one of them. But really for me, it's also screening, because even though many of us don't meet the normal criteria for screening, the fact is the people who need to be screened aren't being screened at the rates that they need to be screened, and they're not getting to take advantage of the research that is now available, because and I had a cousin who was diagnosed soon after me, and he was, you know, a smoker, and he just didn't want to know anything. He didn't want to know. It's like, you know, and it's like, if the more you know, so it's like, I start to introduce myself and saying, instead of saying, oh, and I never smoked, I say, I didn't have any risk factors, but thanks to science and because really also, I like to show, so I was supposed to say something short, y'all. I'm sorry. I should have.
We got time.
I should.
You're cutting into Q&A.
I want people to be able to tell their story, right? To try to tell somebody new their story, but also we want to keep in mind that 80% of people who are diagnosed still were former smokers or current smokers, and there is hope for them as well, right? Or you're exposed to radon. You know, I actually, after I was diagnosed, I had my house tested, because I'm like, I've got kids, and what if that was it, right? And so we need like all of this information out there. We need information on screening. We need information on exposure to radon.
My advice would be, as new advocates, especially, your peace is important. You're going to find, I believe, you're going to find situations where you're going to be asked a lot of you. Know that your time is valuable and that you should be compensated for your time, and set boundaries.
Oh, say it again for the people in the back. Mic drop. No, just kidding, Cody. I'm just kidding.
Listen,
Girl, that part.
because I am fully going through that right now, right? I think with everything that everyone has said, I fully concur. Advocacy it can be as little as, you know, telling someone your story, to as big as, you know, what Lakimba does and going to Capitol Hill and doing legislature. Not everyone is meant to be a carpenter. Not everyone is meant to be a doctor, right? You do what is in your lane. You do what you are called to do, and you do that to the best of your abilities. And when you need to take breaks because you are a survivor or a caregiver, take those needed breaks. Because as Colette said, you will get pulled in many different directions. But you have to also remember what is the most important is taking care of yourself, right? Especially if you are a survivor in this field. So I think that would be the one key point that I would say is, yes, put yourself out there. I have grown so much in this advocacy journey, ways that I would never had if I was never diagnosed with lung cancer. And I think that for some weird reason, I now enjoy the lane that I'm in. Right? It's all about reframing and learning from the experience and sharing what you've learned to other survivors so that they can take the baton on. You know, I've learned so much from advocates who have passed on, and I can pick up that baton and run with that baton. And it's about, as Lakimba said, it's a marathon. It's about handing off that baton and making sure that we do the little that we can to make everything better.
All right, let's give a hand to the panel. We got a little time for Q&A. If anybody has any questions for the ladies up here, please feel free to raise your hand. I'll probably give you the mic. Yeah. Anybody? Are we that good? Uh-oh. Oh, boy. Yes. Yes, sir, Mr. Spears.
I'm just curious, once you were diagnosed, what was your next step? I mean, I'm assuming you had to advocate for yourself first. And doing research, was researching what's available to you in your community. So talk to these doctors and find out where there's a support group in the community that you go to. What are the steps to becoming an advocate? Obviously, as I said, advocating for yourself, and then, finding out what resources are. So where did you go?
That's a lot.
So I think the first step is to educate yourself. You can't advocate for something you don't know anything about.
Yep.
All right. So learning about lung cancer is the best first step, right? Thankfully, we have internet now. I remember when internet wasn't there, right? But you can go on and search for different nonprofit organizations. You can get so much information out of Heal Collaborative and even some other mainstream ones, the American Cancer Society, GoTo Foundation. There are many different foundations out there now, thankfully, that share all of this information for you to get educated, right? And then the next steps would be, reaching out to these organizations to see if they can connect you to lung cancer survivors, right? A lot of these nonprofit organizations, they have like phone buddy programs or ways that they know all of these advocates. They can send an email to do an introduction. Those are ways that you can get attached to people, and then from there they can help to guide you.
What she said. I think community is key too. So like finding a community of people, I will say like finding the community that I have has changed my entire perspective on everything. Just being able to talk to folks, just listening to other people tell their stories and what they're going through, it puts things in perspective for you. It helps you to, compartmentalize what's going on for you to help care for others. Sometimes you need that distraction. But honestly, community is so key. So find somebody, anybody, people that can rally around you and that you can rally around, because sometimes you just need those shoulders, when everything else feels like it's crumbling. So anybody else want to add?
For me personally, my very first step was to find a mental health provider. I didn't feel comfortable talking to family members, especially that my husband was also a survivor. So I needed a neutral space to say what I felt. So that's the first thing I did.
I like that.
I feel like you all covered it, Definitely mental health is at the top of that. But yeah, I definitely like the way that Sydney laid it out. It's pretty much those steps. And it's helpful because a lot of those organizations, they'll introduce you to someone who will kind of guide you. I think all of us were led by another advocate into this space and into other spaces. It's always been advocates who've introduced me to other organizations. So,
any other questions? Oh, you want to answer that?
What I did was I researched that one. I was like, God, okay, the doctor don't know what to do with me. Because he's talking about I'm young, and he just learned to check the biomarkers. He literally just learned to check the biomarkers. I was one of the, I learned to find one person that beat it. One person that beat it, or that's in remission at my particular stage, 3-4. And that's what was in remission maybe over 3 years or 4 years. And that's what made me, that's what made me go into it, because I had to figure it out. And it's whatever they say too. I broke the words down, found out some of the words are Greek, and with kinesis and ecclesiastic and lymphoma. So I'm like, okay, so it's in my lymph nodes. If it's that, I was figuring it out. So that's that's how I did, and went for it. Oh, another thing I did, so I just started juicing.
Oh,
Yeah, I started juicing.
it takes so much time though.
Yeah, it does.
But, all right, so I think we're out of time. We probably have to wrap this up so that you folks can get to your next breakout session. Let's hear it one more time for the panel. You guys did great. Thank you guys for coming in today and for listening to us. Hopefully you take away something from this conversation and you can help move the needle forward when it comes to advocacy. Again, anything you can do is helpful. So yeah, we're around for the rest of the sessions and whatnot. So please feel free to connect with us. And if you need anything, let us know. But we are...